Welcome to the LowCarbMD podcast. No one is beyond help. No one is beyond hope.
As we have always said, we are bringing you medical information and cutting-edge science, but none of this is medical advice. Please seek out input from your own doctor.
Hello and welcome to the LowCarbMD podcast. I have to remember which podcast I'm doing because I just did another one with Dr. Elie Jarrouge, who's joining us today. Tro, like, this guy's awesome. Came from Lebanon. Unfortunately, he had to spend some time in New York, so I think that was kind of a culture shock for him. Trained at in Buffalo, right? And then went on to some place called Baylor. I guess they're pretty good medicine stuff over there in Texas. And now he's in Houston, Texas, doing hospital work, and he's trained in nephrology also. And now he's starting to see the benefits of low carb and helping to keep people out of the hospital. So, Tro, good to see you, man. And we'll welcome Dr. Elie Jarrouge. And I think we're going to have a great discussion with three of us docs together.
Thank you, Tro and Brian, for having me.
Yeah, let me tell you, I've been following your stuff on. I know we talked a bit just a while back on how to get started, what to do. You know, I know you're doing amazing work. I can tell by what you're posting. I've seen some feedback that you've posted from your patients and some results that you've posted on Twitter. And it's just, I can tell you, I know that there's a kindred spirit here. Your content on Twitter has been off the hook. I love it. You know, I love it. So it's nice to have you here. And the fact that he's smarter than both of us, Brian, he's gotten more training. He's a nephrologist.
No. He's like Jason Fung, man.
We all know hanging degrees on the wall doesn't equate how smart you are.
No, but you know, the nephrologist, they got to do all those calculations, you know,
millimolars
and milligrams and deciliters.
Exactly. I remember sitting with the nephrologist saying, explain this stuff to me one more time about all the stuff, the acid base, when does this stuff get absorbed? And it's pretty amazing, but you have to understand physiology being a nephrologist. Really, it's really, really critical. So plus this guy, I mean, if people have a chance, go listen to my other little fledgling podcast, Life's Best Medicine, because we talk about the behind the scenes, where he came from Lebanon, the culture shock of coming here, losing a sister at a young age, and you know what you lean on when things are tough. So it's not just about low carb, but this is a huge component of it. And you know, and just as a background, the reason Dr. Jarrouge came to my attention was on Twitter. He early on in COVID, he posted saying, this is tragic because I'm seeing mostly obese diabetic patients who are dying of COVID. And I think there's a big problem here. And when he did that, he got attacked on Twitter for saying he was fat shaming people, which he was absolutely not. So I kind of jumped in and got into the fray a little bit and said, look, give this guy a break. He's just saying what he's seeing. And then lo and behold, months and months and now a year and a half later, people are saying, yes, these are the risk factors. These are the comorbidities that are leading to death or intubation or ICU stay. So how can we prevent that? So Doc, welcome. It's great to have you. And I appreciate your stand on Twitter.
I love you guys. I mean, I owe you both for my journey, because it's easy to copy somebody who's already a pioneer. So whatever Tro does, you do. I'm like, this works. Now I feel like very in line with Tro, even with all these things that he disagrees with other people. I find myself agreeing with Tro more often, and I see it because clinically it kind of matches that. So.
Yeah, you know, we should talk about physiology, because like that's his bread and butter here, right? That's the bread and butter. You know, I want to talk a little bit about this. You work in the hospital, okay? And I'm sure you've seen, you know, I've seen it. I've been in the hospital. They've asked me to continue to work. I'm literally working tomorrow night while COVID is skyrocketing. I'm going back to the hospital, and I've seen people pass away. I've seen people intubated. I've seen the worst. And one of the things that struck out to me, and I remember you posted this a year ago, was somebody, you know, who was unfortunately young guy in the hospital, 43 years old, intubated with COVID. You know, intubated means they can't breathe and we have to put a tube in them to help them breathe, critically ill. And the entire staff was helping them. But one of the things that they said was, you know, this is a healthy young 43-year-old. And I was like, okay, I'm helping this patient. And I went in and I looked into the historical record, His triglycerides were in the 300s. His BMI was, 31. His blood pressure was high. His HDL was very low. I mean, he looked like a normal guy.
Yeah.
He looked like a normal guy. And so I know what people were saying, like a young, normal guy, right? And it made me think like, wow, our like metabolic syndrome has become so common that we think it's normal.
Yep.
So
we're the freaks who are abnormal by not being the normal, the average.
So what have you, and I remember you posted this a year ago, like, guys, metabolic health is critical to this. Yeah, I mean, all these things that we're doing, the public health, it's important, but, there's going to be a new virus. There's going to be a new variant. There's going to be a new thing that the vaccine doesn't cover, and you have to be ready.
Yeah.
So tell me, what have you been seeing in the hospitals?
So from early on, I mean, I was more already metabolically oriented. So I see people in terms of metabolic health. I see insulin. I imagine insulin level in their body. So a lot of the young middle age, so 30s, 40s, 50s, who were ending up in the hospital, I haven't seen a single one that is like fit or slim or anything like that. They don't have medical history, but they have visceral fat. They're not obese, so it's not a lot of them. They're just visceral fat, at least the common denominator. Many diabetes, many with obesity and other things, heart disease, different things like that. They get crushed by this virus. And you get 90-year-olds who are lean and then just come in and out, a little bit of oxygen, and they're fine. So that was just very hard to watch and then comment, because people are in such a sick state that it's hard. I couldn't even tell them what's going on, because it's not about blaming them or anything like that. So the more I saw it, the more I got frustrated. So I started tweeting about it, kind of a different way to vent. And, you get attacked for that. But metabolic health is the root cause of everything. I think from infection, you do worse. You get cancer, you get heart disease, you get everything. And we still don't see it. We still don't think about it like that.
Yeah. Imagine if we had a ticker for every diabetic death that happened. Could you imagine how panic if you turn on CNN and Fox News and you see how many people died today of diabetes related diseases without COVID, before
that would be
COVID?
Terrifying.
You would be terrified, and people say, we have to make a stand. We have to do something about this. But unfortunately, that has not been the forefront. And I think that's where a lot of us have been frustrated, saying, gosh, for me as an outpatient doc, I can say, look, if I can prevent them from getting to you, I've done my job.
Yeah.
Right. So the problem is my hospitalist friends are saying, look, you guys don't realize how bad it is, because the reality is you guys are funneling all the sick people into the hospital. Right. And that's the problem. You're seeing a different population than what I see in my clinic every day, in my shiny, bright, happy place here, trying to prevent disease. So I think that's part of the problem we've missed, is the outpatient docs. We're not doing our job to keep our patients from you, keep them healthy enough so that they don't end up in the hospital.
Job security. Just kidding.
We're giving you job security. I want to put you guys all out of business, right?
The sad thing is, you'd think all the hospitalists, everybody in the hospital would see it the same way. When I do something about it, and it just becomes another thing with so-and-so's diabetes, just kind of a sentence, and nobody really focuses on it. And I'm like crawling out of my skin. It's like, this is a crisis. We can do something about it. I even emailed, one of the vice presidents at Baylor. They emailed these encouraging emails every week about in the middle of COVID. And about how to prevent and mask and all that. It's all great, but look, this is what it is, diabetes, and we need to focus on nutrition. I mean, it was nice about it. He said, but right now we have to deal with now, which if we had dealt with it now, then it's a year later, we can reverse a lot of things. But I understand, in the hospital setting, you can't do much, and it takes the whole system to change things,
My wife, and I'm going to plug my wife here, I got the best wife. Sorry, Brian. Listen, but when we were in our hospital system here and she saw what was going on during COVID, that they were basically, giving out Krispy Kremes She's like, look, why don't we give these people, these nurses, these frontline workers, the thing we can do is give, they want something that tastes good without the sugar. And we know hyperglycemia makes COVID worse. We know diabetes makes COVID worse. So she literally cooked up, I don't know, it was like 500 or 1,000 cookies, something like that, and gave it to the entire hospital. I mean, it takes a village. You're right. And, I got an email from the ABIM saying, share your uptake of the vaccine before, like literally the day the vaccine was approved. We got a letter from the ABIM saying, please share your uptake. But, we could have done, we can do, the whole country put on masks. They will do what we tell them. Yeah. Imagine a country that's told to eat properly.
I think a big percentage would have done it. I really believe it. It's, I mean, people believe, I mean, I don't blame people. I see people make fun of people who wear masks or do whatever, but at the end of the day, they're trying their best. They're doing what they think is right by what they've been told. But nowhere on the news, if you turn it on, which I haven't done in over a year, that you see anybody say, hey, you got to cut out junk food and eat better. I mean, nobody does it.
I posted, after they sent this email, ABIM, the hospital also sent me an email, please, wear 2 masks at the time. That's what they were saying. And I took a picture of the food in the doctor's lounge. And it was, Kind bars and potato chips and chocolate and, Chex Mix. This was like the food in a doctor's lounge. And I just thought to myself, like, we have it so, I mean, I'm not denying, yes, wear a mask, okay? It may make you feel good and it may, mitigate some minor risks. Yes, go get vaccinated, but like we are missing it. The vaccine now you see with the Delta, it's not as efficacious as we thought. We're seeing a lot of breakthrough cases already here in Connecticut and New York. I don't know if in Texas.
Yeah, I mean, this past week is just climbing quickly in the hospital.
And it's a bigger issue. I think the big issue is we have to be able to see and for instance, what you saw in the hospital, you say, here's what I'm seeing. And a lot of us have to say, here's what I'm seeing. No, I'm not seeing that. I'm seeing there's something different here. And I think what we're finding is in the countries like Vietnam, you look at their numbers compared to ours, it's unbelievably, they did so much better, but they're metabolically healthier in general than we are. And you start looking at the underlying metabolic health in certain countries and you say, well, they did a lot better. What we're seeing is the people who are metabolically sicker with more diabetes and obesity are having higher death rates across the board. I don't know if there's an exception to that. Someone's going to probably call me and tell me there's an exception, but I'm saying in general, that's what we're seeing. And so in the sickest cities, the most obese cities, and we're seeing more COVID deaths. And so I think that's one of those things we have to step back and say, okay, what can we do to prevent it? What can we do to intervene? And I think that's where we have to look and say, you can't say it's not for today. It's like saying, hey, let's contribute that. Even if it's a minor contribution, if we could save a couple thousand lives, that matters to me, right? And just saying, hey, let's reassess. But none of our leaders have talked about the importance of metabolic health. And I'm telling you, this is what's going to come to the forefront as a result of COVID. The stuff we've been talking about will come to the forefront because personally, and I'll knock on wood or pray or whatever, but none of my patients have been admitted to the hospital for COVID, not one. I'm focusing on metabolic health. I may just be lucky and I have a small portion size. There's no doubt about that. But you look at Virtus, the Virtus comparing themselves to some of the big hospital and they're crushing them. I don't know if you guys saw that. It's very impressive. You drop the admission rate from 44% to 11.9% for, intubation from 5.9 to 1.9 and death rate from 1.9 to 0.3, cutting carbs, and having a more interaction. So of course, that's going to be a smaller portion size on average. And so there may be some error in that, just because of selection. But I'm telling you, there's something to metabolic health in this setting.
The sad thing, you can show people data. I mean, pros showing data every day, but people believe what they want to believe. Reason and logic and data doesn't really change people's mind for some reason. And it shows because when doctors, my colleagues, the reason I'm not hopeful for that to change, because you have to have whoever is giving advice following their own advice. And most doctors in the doctor's lounge, as etc., you have a fridge full of sodas and juices and granola bars and all that stuff. And they're just, from cardiology, I mean, a lot of cardiologists go between cases. You see them in their scrubs, walk in, chug this juice. And so they don't see it. They don't get it. They don't understand metabolic health, unfortunately. So how are they going to advise their patients? Because they go back low cholesterol, low fat, and they order that on their diet and just start, I mean, what are you going to do? You got to have to target the clinicians. So it's on us, and like you, sometimes I feel like I need to stay in the hospital, at least to have a small effect in some people, and they can take it to their families. So it's very frustrating because I don't see that changing unless the doctors change themselves and with their own lives.
Yeah, I think that's why it's so important. Things like what Doug Reynolds is doing, and with the SMHP, the Society of Metabolic Health Practitioners, getting doctors educated. I'm just curious, how did you get? I mean, you're like a brilliant guy, man. SUNY Buffalo, Baylor Internal Medicine, Baylor Nephrology, duly board certified. I mean, how did you go down the rabbit hole of, man, processed carbs are not good for humanity, right? Was it after we made drugs to pee out carbs, or was it,
yes, that was it.
Before or after?
It like most of us, it started with own personal experience. So, I mean, traditionally trained, traditional advice. The reason I went to hospital medicine because I didn't want to deal with chronic diseases. And I hated to manage diabetes and high blood pressure and heart disease and all that stuff. I just wanted something to fix. Until I had my own health issues. I was in my late 20s, started gaining weight, and I gained over a period of 8 years about 35 pounds. And I started having high blood pressure, and I've had chronic back pain for years. Eventually, it started where I was trying pants on, and my back gave out. That was like 8 years ago. And I was on the floor. I don't know if you've had back spasms or something.
Terrible. It's terrible.
It's the worst feeling. I cannot even imagine. It's just miserable. There's nothing worse. You just have to be on solid ground and just lay there. So I had for a year, I kept having flare-ups every couple of months. I play tennis. Like every time when I serve, my back gives out. I try yoga, my back gives out. I go to the gym, my back gives out. And I couldn't make the connection, had MRIs, physical therapy. Eventually I was told, like, why don't you look at your nutrition? I was like, what are you talking about? How does that food have anything to do with my back? But out of desperation, one time I was, the Whole30 was popular. And paleo was like, really 2014, 2014. So it was, it was a big thing. So I started the Whole30 program, and a month in, I lost 15 pounds and my back was like tremendously better. And I did it another month and I, lost another 5 pounds. And then I was like, that's awesome. So I figured I could stop and go back to my old life because I missed my carbs. And then I started having back issues again. And so this is when I was learning about keto. And then I was very scared of it initially. And then
what year was this? Well, I'm just curious.
That was so 2015 is when I was doing Whole30 paleo. Then for a year I was kind of a non-committal, kind of in between. I think 2017 when I came across Gary Taubes, How We Get Fat, and I read Jason Fung, and I'm, oh my God, all of a sudden I was like, I have to just try something else because I wasn't happy with my health. And then keto was the thing. So I did dive into traditional ketogenic diet. I went all in, like high fat, everything for 3 months. And I lost all the weight, 30 pounds total. So 20 before, then an extra 10, and it was lean. And this is when light bulb went off. I was like, I can't ignore this. I have to tell people about it. And this is when around the time I was following you, I started following these people on Twitter. I was a fly on the wall. I wasn't really participating. I was just learning and absorbing and seeing what people have to say. And then I developed a keto rash in my neck and chest, and I couldn't get rid of it. And I realized, okay, because, you know, when I learned about keto, I thought that was the way, that's the only way. And I became overzealous about it. Then realized maybe it's not for me. So, and I was told maybe I'm not eating enough protein. So all these tools started kind of accumulating in my mind. When I added protein back, higher protein in my diet, the rash went away. And then I started getting interested in a lot of these things. I went to Metabolic Health Summit, and I you know, read Ted's book, and so I started kind of building my own, I guess, style, and reached a point in the COVID that I was like, okay, I cannot just be a hospitalist. I need to branch out. So I started as you know, as a hospitalist, you have 12 hours in a day, so it's not like I have an appointment. So I see my patients, I do my work, then I go back and talk to them. And this is how it started. It started like for a year or two, really, this is just free on free time. And the best two patients I had that made me pivot is one was, she's in her 40s, severe hepatic, fatty liver disease. They were discussing transplant. They started transplant workup. And the husband was there, and they don't want to do that. They were desperate to do something different. She was starting to get confused. And I thought, oh, look, this is not advice. This is an opinion. Do what you make what you want with it, but you can stop all sugar right now and start fasting and just don't eat any food in the hospital and just do that for a few months. The worst case scenario, nothing changes, but best case scenario, you change. And they took it to heart. And I didn't see them again. And I checked a few months later, she left the hospital, and I emailed the husband, and her liver was back to normal. Like, she went from being evaluated for transplant to being a normal person, lost all the weight. The husband who had open heart surgery, they're both now biking and hiking and all that stuff. And that was really the biggest thing. And the other patient was the patient who was getting readmitted to the hospital for hypoglycemia, and they were putting her on sugar IV dextrose to treat it in the acute setting. And it drove me crazy because the endocrinologists were managing that. And I kind of went against them, and I told them, look, I told her, you cannot, this is why you're hypoglycemic. And I had to explain to her, you got to avoid the carbs. In the short term, you may be rocky, but eventually it won't happen. And then she stopped the carbs, and the hypoglycemia stopped. And at the time, I'm still learning, you know, all these insulin spikes and things like that. But that was a big pivotal point. And then COVID and isolation and seeing all these patients, and I started tweeting slowly, and I built a website and started dabbling. People reach out for help, and I started kind of experimentally working with that. And now this is what I want to do, and I love doing, because seeing patients, taking them off medications has been the really why I'm a doctor, that I realized 10 years later.
You know, can I ask you a question?
Yeah.
Why'd you go into medicine?
You think you go to medicine to help people and cure people.
No, I mean, so like, to walk me back, you're like, what's the moment, you know? What's the moment? Brian, you know, I don't even know this for you. So after
I know this story, man. I know this story. I can cheat. I can
the
say
moment
it,
is my grandmother. So growing up, I was 8. My grandparents, it's common, my dad's parents lived with us. My dad was an only child. So they were older, they lived with us. My grandmother used to get sick all the time. And a family doctor would come visit, house calls, and do tests, portable EKGs, sometimes give her an IV bag. And I was fascinated by how a doctor can come, do things, and she would feel better. So I started collecting syringes and tubes and things like that are clean, minus the needles. I would play doctor, and my family would call me doctor at a young age. And I learned how to take manual blood pressure measurements at 8 or 9 years old. And every day, one of my favorite things to do is to bring in and go to my grandmother and then measure her blood pressure. And she loved it. She loved, you know, like this young doctor taking care of her every day. So that was the moment where I knew I wanted to be a doctor.
And how long did it take you to feel like a doctor? Can I ask you a question? How long did it take you to feel like a doctor?
I still, you know, I don't know, man. Sometimes I feel I'm not the doctor yet. I feel like I'm just a human being. But I think really I was a doctor in a sense of taking care of people and helping others from a young age. So I think I've always been this caretaker of a family and care even before I even understood what doctor really needs.
Do you think like the draw to wanting to help with chronic diseases, you know, I'm talking about myself, so maybe I'm projecting, but like it makes you feel like a real doctor?
I honestly did not want to do chronic. So when I did internal medicine, I was like, I will not do primary care because I hate chronic diseases, because you learn diabetes is chronic and advanced. I don't want to just prescribe medicine. So all these things about chronic diseases and progressive, I felt it's not fulfilling, because when we do clinic in residency, it's the same stuff, prescribing things, eat better, exercise more, all that stuff. So that was not appealing to me. Then I did nephrology, to learn more physiology, but at the end of the day, I wanted to fix things, but I didn't want to be a surgeon, though. And hospital medicine was a nice kind of come in with an acute event, and you treat and you feel better about yourself, until I start seeing the same patients come back more, the same people with more progressive diseases. And when I realized that we can reverse this is when I fell in love with chronic diseases. And then now I'm like 180 degrees, where I didn't want to deal with chronic diseases. Now I only like chronic diseases. So, I think I came full circle and became more rounded as a doctor once I went through my own health issues, and now starting helping others reverse. So, that's.
God, that's kind of crazy. You actually even didn't like it, because you were, in your mind, it was like, I can't even fix this. I can't help this. It's boring. I'd rather just go in the hospital, help people acutely, get them out. And at least I did something.
Yeah.
Right.
Exactly.
But now you're like, wow, that thing that I thought I didn't like, I can affect it. And that's kind of crazy. Brian, do you mind? I know we got you here, Dr. Jarrouge, but I don't even know, Brian, when did you decide you wanted to be a doctor? I'm just curious.
Well, I used to play doctor as a kid too, but I got in trouble for that back then. It wasn't as cool. I didn't check blood pressures and stuff, but really, I never had a desire to be. I wanted to help people. I knew I was thinking about physical therapy. I was thinking about different things, and I went to UC Irvine. I was getting really good grades, and I think, I'm surviving organic chemistry, all this stuff. Maybe that's what I'll do. But what really happened is, in undergrad, a buddy of mine who's now a dentist said, hey, we should do this Flying Samaritans thing, go down to Mexico, bunch of docs, you hang out and go out for margaritas at night maybe and stuff. And I'm like, okay, sounds cool. I'll go and check it out. But there was a bunch of docs from USC, young guys. One of the guys was from Nigeria, because I always thought doctors were stuffy, and it wasn't. I'm a blue collar guy, right? And so this guy, and no doctors in my family history anywhere. And so this guy from Nigeria was there getting his, and he was telling me about his life. And he came from Nigeria. He was getting a medical degree. He told his parents he was working as a bartender. He didn't tell them. He was just, I'm going to walk in and say, I'm a doctor. Here's my degree. Thank you for all you did to help me. And I was like, wow. But all those guys were helpful. They were there caring for people, and they were just common guys. They were just cool guys to hang out with. I'm like, I could do this. And then I ended up getting into USC, and then, the rest is kind of history. I had an old doc that I saw him just loving on people and knowing the whole family. And I go, that's just cool. Like that you see, he knows the grandpa, now the dad, now the grandkids, he's been taking care of all the family. Now he's getting older, and, the wisdom these guys have. And I realized, what, there's more than just throwing pills at people. It's that human connection. The human connection is what really brought us to medicine. When you think about it, that you could really, we hear stuff like in the first 5 minutes of talking to someone, we hear stuff that they haven't talked to anyone about before. A lot of times, that intimacy that you have with someone, where they have to feel comfortable and they have to know that you care. And I think that was what I saw as the tragedy of medicine, is that when you have 8 minutes with a patient, you can't bond. You can bond a little bit, but you have to spend time doing notes and all that kind of stuff. So that's what brought me in, really, is just saying, I really want to help people. How can I be most effective? And then I realized I wasn't effective, and I said I had to make a change. And I think all three of us went through the same thing. So Tro, how did you know, man? Since we're doing show and tell today, when did you know, like, hey, I'm going to be a doctor? Was it like from childhood, or is it something that?
Yeah, no, I remember. I mean, like, look, I grew up in a household where every single member in the house was obese, and we were told that it was genetic, and we should just eat less. And I remember the age. I was 11 or 12 or 13, somewhere around there. I had some ideas about going into medicine. I remember walking into that pediatrician office at the age of 12, the same weight I am right now, like basically 200 pounds. And I remember getting on that scale, and the guy basically, the doctor, I remember him clearly, Dr. Adis, looked at my mom overweight, looked at my brother overweight, and it's like, it's your genes. You better eat less, And I walked out of there thinking to myself that I have to beat the gene. I have to beat my genetic I have to beat this. And that it was, it took me to a bad place. I didn't eat for about a month after that. I ate nothing. So it was my first fast for about a month. I'd say it was anorexia, to be honest with you.
Yeah.
I broke my fast with Diet Pepsi. My whole family was concerned about me. And then when I lost weight, and then to keep that up, I basically ate vegan. I just ate lettuce and carrots because, calories. And that was it. I was like, I have to go to med school. I beat the gene, all it took was vegan, anorexia, an eating disorder and veganism to beat this. So at a young age, I was really, I saw my family suffering, my family suffering. And that's really what pushed me. And I've been on that road since, basically. But I have to come back because Dr. Jarrouge said something that was really, really interesting, and I want to focus in on it. He said his back pain went away, right? And he saw that, and were you convinced it was diet, or were you still a little?
No, I was like, oh, coincidence. Doctors are the worst patients. Like, you don't want to believe something you don't want to see. So I was hoping for a reason not to have to be on a different diet than my croissants and bread. And, my favorite food is, panini press type thing, melted cheese,
Do you guys have knife? I don't know. Is that a Lebanese thing? Or
I went to Lebanon. I just came back from Lebanon and I had a knife. And it was all pleasure. God. And I have a picture of my mouth. Like, I had it once. No regret. It was,
guys, just so you know what knife is, it's basically dough, melted cheese, like a ricotta cheese dough, like a stringy dough, and a bunch of like rose water and sugar. Yeah. It's basically carbs and fat. It's like anti-PE,
It's amazing. It's amazing. Yeah.
Yeah. So okay. So what's interesting, and I don't know if you know this, there's actually interventional trial data showing with knee arthritis, that low carb diets versus low fat, they did low carb versus low fat versus control. Knee arthritis, okay, the pain and your ability to kind of persist after 12 weeks is better on a low carb diet than a low fat diet, and much better than control. In fact, the low fat diet got worse compared to the control.
Yeah.
Right. It was a small study. It was like 50 people, but an interventional trial showed that a low carb diet improved knee osteoarthritis. Can you believe that? Did they teach that in med school?
I believe it because I see it all the time. And you know who I picked up the phone with the first time I saw it? I called Ben Dickman. I go, Ben, you're not going to believe this. It's because the weight loss is less stress on the joints. And he said, no, it's physiologic. And he started explaining to me. I was like, okay, cool. Thanks, man. But, when you decrease inflammation and the chondrocytes start working, it's pretty amazing, the physiology of what happens when you get sugar under control.
Yeah, the back pain was like this band. It's like you don't remember how much weight you were carrying, like this tightness in the back, until it lifted, and all of a sudden, like, you're moving and you're so happy. And I believe this because I don't know. I did this group like 12 people, group coaching, recently, and everybody started their arthritis and everything was just disappearing. They joined for weight loss, and all of a sudden, all the back pain, knee pain, and ankle pain, they all disappeared. So totally believe it.
Yeah, I mean, so we have even interventional trial data. How many orthopedics have you seen put people on a low carb diet? How many orthopedics have you seen prescribe opioids? You know?
Orthopedic doctors, listen, I'm going to tell you something. I'm going to give you a little insider tip. Look, send your patients to us. We can get them healthier. You're going to have less post-op complications. This is what I've been seeing for a long time, is that if we could work together and say, look, you got someone who needs to get their knee replaced. There's people that are so obese and their diabetes so out of control, you can't do surgery on them. The risk you take is that some of those people are not going to need surgery and you're going to lose some business. But other than that, we can help you get people, to a healthy place where they're not going to die on the table or shortly thereafter. I think that's something we really have to look at from a metabolic standpoint. So the perfect union is low carb docs and orthopedic surgeons. That's what I've seen for a long time, because I'm seeing people get better. They're better post-op. They're better at recovery. They're not going to blow their knee out when they're, not having 500 pounds on it. If they have 200 pounds, a lot easier on it. So yeah, I think there's a lot of that people are starting to take note of. And there's some good orthopedic surgeons out there who get it. Gary Fetke being one of them, and some crazy guy named Sean Baker who gets kicked off Twitter. But you look and see what they're doing, and you say, wow, this is why they're taking a strong stance, because they saw the benefit in themselves and their patients also.
Can I ask you a quick question? So now, all right, you've seen the light, so to speak, but you're still in, working as a hospitalist. You probably still enjoy it. What's the future look like for you? Where do you see medicine going in a couple years for you and in general? And where do you see medicine going in 5 years for you and in general?
Sure. Sometimes you have this feeling, that guiding compass, that it's pulling you a certain way, but you don't know where you're going. So that was me in the middle of the pandemic, where I thought I'd be a career hospitalist all my life, but something all of a sudden changed. I realized this is not it long term. So, as I started coaching and helping people online, I found so much joy in helping others that way. I had this crazy idea to cut down on hospital medicine without having a good, solid plan, at least financially, to do that. So, but I did take a leap of faith back at the beginning of the year. I cut down 50% on hospital medicine, just to kind of maintain that connection, and at the same time start grow this metabolic thing. So I think the future is metabolic health. The system is not sustainable. I mean, they keep building hospitals. We're always full, staffing issues. I mean, it's a disaster in hospitals, not just our hospital, every hospital. People are sick. I've been doing this for 8 years. People are sicker and sicker. The complications we see is crazy. The interventions, the fancy procedures they have to do to kind of salvage a limb or a life is cost prohibitive. I mean, it's going to break the system. I already did. So I don't know when and how and who's going to do it, but I think people are waking up by themselves. And I have people reach out, say, I want out of the system. I want to take care of my own health. So they're taking ownership of that. Unfortunately, that's how it's going to be. It's going to be slow. And the way I don't know, I think I see myself more a metabolic doctor and continuously de-prescribing medications, because I think this is what we're meant to do, to heal, not just manage. And I feel it. And I don't know how long it's going to take, but that's how it's going to be. I believe it.
I think the whole, maybe Brian, you could talk about this. I think the system with the higher and higher deductibles that we're seeing in the insurance market, it's forcing people to say, okay, I'm going to be spending $5,000 to $10,000 one way or another. Let me see what's the best kind of care I can get. I mean, Brian, have you been seeing, people are like, I'm booked out for months. I never thought this day would come. I was scared. I know, Brian, I we were consoling each other a year ago.
I'm telling you, man, Turo, you had a huge influence on me. You're like, just get out. What are you doing, man? Get out. I'm like, I can't. Look at, I was making good money and stuff, but I'm telling you, my job satisfaction, just sitting with my wife the other day in the jacuzzi talking, and she said, you're a different person, right? She said, I could tell you didn't like the person you were when you're at your old office because you were so busy, stressed. You would come home every night. How was your day? Brutal, so stressful. I got yelled at by 3 people. It was like never is like that anymore. Troy, I was thinking about it. I remember you telling me, and I don't know if you remember this conversation, but I'm like, we were actually it was right before I quit my job, as a matter of fact. We were in Boca Raton at that when you let me crash on your couch because I didn't have a room, remember? And we won't tell the whole story. I did sneak into the bed, but that's a topic for a different day. Troll let me sleep on the edge of his bed as long as I didn't touch his blanket and didn't share a pillow or anything like that. And I had to be very distant. We were social distance, and that was even before it was social distancing time. But that being said, Troll was nice enough. He was very nice to me because he said my wife and my mom would shoot me if I let you sleep on the couch as an old man. So anyways, Tro says, I said, what are you doing after this conference? And when I went back after that conference, it was a disaster. I could use profanity to tell you how bad it was when I got back. I was working 14, 18, 20-hour days for a week trying to catch up. And when I went, I said, he had to leave the conference early because he was going on a cruise. I'm like, you're going on a cruise? Who's covering for you? What was I just answering my calls? I mean, when I get back, I just go back to work. It's no big deal. I just got back from a week vacation and like I had nothing. Like I just walked right back into my work because my patients are doing better. They don't call me all night with all these problems because they're healthier. So it changes the whole dynamics. And I thought Tro was nuts when he was saying that, but I'm telling you, my quality of life has improved significantly. So I'm saying patients out there, look, most of these direct primary care docs out there, they have time for you. They're going to call you back the same day. They're not going to have 50 people, to call back at the end of the day. I'm telling you, it was like, if you took a breath, you would be falling behind. You were always on a treadmill going too fast. And that's the problem in the system is, think about it. Those doctors who are seeing 50 patients a day, they have to review 50 different labs. They have to consults and disability papers and all that. These people are working their tails off, and they're not going to have time to call you back that night. Or if they do, it's going to be 9 o'clock and they're going to be upset and tired because you can only call one person back at a time. So if you limit your patient population, now you can provide good care. So now if someone calls me, very rarely do they call after hours, but if they do, I get right back to them and I can help them. And they're like, I can't believe you're calling me back. I called my wife's doctor 20 times and no one's called me back. Like, that's unacceptable. These are lives and these are important issues. We can't just put it off down the road. So really, anyone listening, if you have a chance to look at a direct primary care, think about it. If it's $100 a month, that's $1,200 a year to have stellar. You have access to your doctor. They know who you are and they appreciate you because you're keeping them alive, right? They've limited their practice size so that they can take better care of you. So that's my plug for direct primary care. I think there's a lot of good docs. And now we're trying to help the direct primary care docs to understand low carb because you have the time now. Now you can explain lifestyle and you can explain the effects of stress, all the stuff we talked about on Life's Best Medicine, saying, look, it's not just about what you're eating. Get enough sleep, don't hate the world, don't work yourself to death, all these things. And now we have to practice what we preach at some point because I know it's stressful being a hospital doc and Tro is like hospital doc doing this. He had so much stuff going on. Now that he could focus on his practice, he's going to be very successful doing that.
Yeah, I think the quality of the care also goes up, right? That's the most important thing. It's the quality of care. And people, when the deductible's so high, $5,000, $10,000, right? Like they need quality and access. They need they're going to be spending the money. You're going to be spending, even though you're paying $2,000 a month, you're getting an $8,000 deductible.
Yeah. And what people don't realize, the way direct primary care saves people money too, is like imaging. Here locally, I can get an MRI for $350, right? You need a brain MRI, because everyone's worried. One's if I need an MRI, and so a lot of people, even with the direct primary care, you can order the imaging through your insurance if you want, or you can pay cash. It doesn't, a lot of my patients who have Medicare, for instance, they can go get their MRIs and the CAT scans that they get in the hospital, all that's covered, but the primary care is cheap medicine. I mean, that's the cheapest place to get your care. But the problem is no one can get in to see it. It's like everyone has a free bus ticket, but there's only one bus. You can only get so many people on the bus at one time. So access was and I knew that in my old practice, access was the problem, because if everyone wants you at the same time, you can only see one person at a time. You can't see them all at the same time. So that's what we run into in medicine. As we become more efficient, we become more streamlined. You have to turn the patients in and out. You don't have time to talk about what's going on in life. And I think that's what we're missing. That's why doctors are the #1 suicide rate right now, because they're not doing, they came in with their white coats and wanted to help the world. Then you realize, I'm not helping the world. I'm just putting a Band-Aid on stuff, and they're going to be back next week. Like what you're saying, the futility, you start seeing that it just doesn't make sense.
What I realized, people really care about that you care. They don't care about how smart you are or how much you know. When you show you care and really check on them and respond in a timely manner, they like blown away. And the bar is so low that, you know, just saying hi to your patient and texting them, they see you like, you know, the best doctor in the world. So we have a lot of opportunity, and the fact that we live the lifestyle makes us more, you know, people believe us and trust us more. And that's why we're having a lot of good results with our patients.
I think the one last thing that you said, Brian, is the burnout, right? The burnout is so critical. I mean, you know, Dr. Jarrouge, you didn't even want to do chronic medicine, like, because you knew, like, I'm not going to get, like, you were burning out.
Yeah, yeah.
You were burning out, and your back was giving out. I mean, you were burning out. And I want to tie two things together here. So just give me 1 minute of yapping, you know, but the 70% of doctors right now are employed by a hospital, by an insurance company, by a pharmacy chain, okay, or by venture capital. 4 groups employ 70% of doctors right now. And if you look, so that means private practice is like 30% or less, right? If you look at burnout, there is zero burnout in private, independently owned physician offices. New survey just came out. Brian, I was thinking about you and your lecture on burnout. Zero burnout. No burnout. Virtually zero burnout. What do you think about that, guys? You know, Dr. Jarrouge, I want to hear your thoughts. Brian, I know you're going to have a lot to say.
I mean, it goes back to autonomy and how you spend your day. When you spend your day, when I'm in the hospital, I see my patients maybe in a couple of hours, and the remaining shift, I'm really sitting and charting and coding and, you know, billing. That's the kind of stuff that makes you kind of stressed out, and social issues and things like that. So versus you own your time, you spend time with your patient, and it's more rewarding. I think a lot of it is doing what you love, versus having to do things forced on you.
Brian, what do you say?
Yeah, I think, you know, you look at the study, you know, you guys probably saw this study where they had these guys dig holes. They would dig holes, like all day they're digging holes, and like, this is stupid, why are we digging holes? They pay. And then the next day they said, okay, we're gonna pay you twice as much to fill the hole back in. And then we're gonna pay you 3 times to dig it out again. And so these guys are digging the hole, put it in, and they're making tons of money, but they're like this is stupid. We're not doing anything. So I think that's what's happening to doctors. We're digging holes and filling them back in. Like you're saying, you patch them up, they go out, 2 weeks later, they're back with heart failure again. You send them back out, they're back with heart failure. They call them frequent flyers. And unfortunately, they're people and they're suffering. And so when you see constant suffering all the time, it takes a toll, especially when you're helpless to make it change. If we can make it change, now I'm telling you, like, just in the last week, I could give you story after story, but in the last week, I have a bunch of women, Tro knows about this, in Vacaville I'm taking care of. 18 out of 23 don't speak English. And they said, we're having a Zoom meeting, and, you know, they're killing it with low carb. Everyone said that you can't reach the Hispanic population. BS, not true. They're cutting back on their tortillas. They're figuring stuff. They're making fantastic food, and they're having fun, and they're getting off meds, and they're doing better. But the point was, you know, they were talking at the end of we were talking at the end of the day on a Zoom meeting, and they said, oh, Mary brought cookies, and she brought cupcakes, and they were tattling on her. And I was laughing because these 23 women, none of them had one. They sat there all day with cookies and cupcakes, beautiful looking. And they said, we're not eating it. And you think, wow, that shows me right there, just in that second, I was like, the power of community, the power of saying we don't eat like that anymore. We know what that's doing to our bodies. And we're going to, they weren't really shade. They were making fun of her, but they were saying, and she's like, they said, take it home to your family, take it home to your neighbors. We're not having it. But I was like, wow, that's hard to do. And you know, if one of them would have had it, all of them would have had it, right? Because no one wanted to be the one that was going to be the one. And so when I saw that, I was like, wow, people sold all these guys off. And now I'm seeing fatty liver disease going away. I'm seeing all these things that we see. Like when you were talking about that lady with fatty liver disease, it brought me back to when we had Rob Sivas on, and I was actually at a medical conference sitting between Rob Sivas and Gary Taubes. And Rob Sivas said, I don't do surgery on people with fatty liver disease. And we basically asked, why not? And he told the reasons. The statistics are overwhelming. But he says, we resolve it in 3 days, and then we go back. And I said, what, 3 days? What do you think? Gary Taubes said, BS is not true. And he said, I've got the biopsies if you want to see them. And to see something reversed that we're spending all this money on, all these resources in 3 days of 2 days of ketogenic diet, 1 day fasting, and Rob being arrogant said, no, it's probably sooner than that, but we only check every 3 days, right? It's like ridiculous. Like, it's crazy. And like, when I heard that I shook my head like, this guy's a nutcase. And then he said, do you want to see my slides? I'll show them to you. And I sat down with Rob and had coffee, and I was like, oh my gosh, this guy's pretty smart. But, you know, when you start seeing stuff like that you can't imagine being true, and I'm hearing stories from people and go, wow, how their life changed. When you see someone's life better, that's why we went into medicine. When someone said, yeah, I used to not be able to walk, now my knees don't hurt anymore. There's no more rewarding thing than that. Like you were saying, it's funny for a hospital, and you'll get this story. He said, I like when people flatline, but he's talking about flatline on the continuous glucose monitor, right? Yeah. Right. If you can flatline your continuous glucose monitor, you're not going to be flatlining very soon on your EKG. Right. So I think that's kind of the thing we're saying, is if we can intervene early. And that's why I kind of take it personal when some of the vegan docs are attacking us for using continuous glucose monitors in non-diabetics. I will tell you, it's the best education they could possibly have, because it's not my opinion anymore. They can see exactly what's happening to the physiology. They can see it before it happens. So why do you wait? And so they were saying you're carb shaming people. It's like, no, you're not. You're like giving them the tools. Because I can see I eat one thing and it spikes like crazy to 200. With cereal, for instance, spikes to 188, 192 consistently. If they have eggs, 70. Which will you choose? You say, well, okay, if I care about my sugars and not getting diabetes, I'm going to have the eggs. And then you can make your own decision. Right. So I think those kind of things, when you see, it's like, that's the same thing as saying, don't check your oil and wait till you blow up your engine, then check your oil. It doesn't make any sense. It never makes sense. That's like saying, don't check blood pressure because it's going to stress people out. Well, you need to know what your blood pressure is. You need to have numbers to treat something. So that's why I'm excited about what you're doing and what Tro's doing. It's the way forward. It has to be.
Did we lose Dr. J?
Oh, we froze him.
Yeah, he froze.
He froze, man. We were talking so long.
We were so boring. He's like, am I still part of this?
No, sometimes we get internet connections. Jack, we'll have to have you do your job and fix this one, man. But we'll see. He'll be logging back in a second.
These two guys are talking so much. I'm out of here.
Yeah, he's probably still talking. Doesn't even know what's happening.
You know, but what you said is so true, man. What you said is so true, and you know. It's just amazing how, especially what you were talking about, Dr. Sivas, it's amazing how quickly, you know, we can get healthy, you know, how quickly. I think that's the most key thing. I wouldn't call him arrogant. I'd call him a prodigal.
Yeah, no, he is. But at the time I thought this guy's arrogant. And then when I talked to him, I go, he backs it up by knowing what the heck. Doc, we thought you got tired of us, man.
We thought you got tired. I don't know what happened. I was listening and
so long, you know.
Welcome back. Welcome back. Yeah, we froze the system.
I heard everything you said, but I froze for some reason. I couldn't talk back.
It's all right. Everyone gets nervous, man.
No, I was saying that CGM is awesome. You know, that patient with 15 years of diabetes, she gets emotional and angry every time.
Shoot, we lost you again, man.
We lost him again.
Oh, yeah, we're good. We just lost you for a second. She gets mad every time she talks about it.
Yes, because it says my internet is unstable for some reason. Yeah, I mean, 2 weeks off medications, flatline after 15 years of diabetes.
Yeah, it's incredible. We're seeing that. We're just seeing people cut their insulin, and it's like it's almost shy. Tro, you know, sometimes I feel like when I see patients, I feel weird, like saying, okay, yeah, we can take care of all this stuff. Like, and it's funny because you know the constellation of stuff. You're gonna have obesity, diabetes, you know, hypertension, you know, swelling in the feet, all these things. And you say, oh yeah, fatty liver disease. And you go, okay, high triglycerides, low HDL, all the stuff we worry about. And you see them, they're like, oh my gosh, I just had a lady, she dropped her insulin level was 29. Now it's 5.2. Like, okay, we'll take that. Right. So, and I'm telling you, here's the thing. Here's the other thing we're going to see is the better we do with visceral fat. That's when you see these scientists, they're not talking about the difference between visceral and subcutaneous fat. I'm telling you, that is something, because I'm seeing people that are 290, 300 pounds with normal insulin levels, and their visceral fat's going to be low every dang time. I haven't seen it. Troy, you may have seen an exception, but when I'm looking at visceral fat compared to labs, I can predict the labs from the visceral fat, and I can predict the vice versa also. You know, you say, oh, okay, it's starting to make sense. Not just by looking at someone, but when you see either the labs or their visceral to subcutaneous fat ratios, there's definitely something to that.
Yeah, and it's all in the literature. If you look at triglycerides and HDL, closely tracks adiponectin. Adiponectin closely tracks visceral fat. You know, I mean, they're like, it's not a far off. Like what you're seeing is, I think, supported by the literature.
Yeah, it definitely is supported by the literature. Yeah, it definitely is. That's why we're talking about waist circumference being so important. So yeah, you know, I think we're on a new. We have a lot of good people looking at this stuff, and we're talking from all these different perspectives. And that's why the movie The Magic Pill, if you haven't seen it, it's worth seeing it.
Yeah, I have. Yeah.
You know, I mean, it's just because it's like you start seeing all these different things get better, and you go, "This is crazy talk." But now that I'm practicing that kind of medicine, as a matter of fact, Troy, I just interviewed the guy from Fathead. Tom Naughton.
Oh, really?
Oh, yeah.
Very interesting. Because I didn't realize I saw his movie. It was 2008 or 2009 that came out. That was well before I even I saw that and go, okay, that's great. Hey, the guy's crazy, whatever. He's trying to make a point. And I didn't really appreciate what he was saying back then. Right. So, you know, a lot of these guys were pioneers that we didn't even because he said he did a lot of research on his own and he realized what the problem was and he lost weight and he got in better shape doing that. So he said, you know, it's the exact opposite of what you guys are saying, which is not very, doesn't make people very happy.
You know, I want to, you know, you're saying like saying the exact opposite. I can't wait to listen to that interview, by the way. I'll be tuning into that one.
You better do it quick because I think it's going to get censored very quickly.
I won't be surprised. You know, Dr. J, I want to ask you a question about this because, you know, Brian just said, you know, hey, it's the exact opposite of what you're used to saying, right? That's what the interview, you know, that's what the quote he just said, right? Have you gotten pushback? I know we saw that pushback you got on that comment, which we felt was totally, all that heat you got was unnecessary. I support the sentiment of what you said 100%. But have you gotten any other pushback from colleagues, from family members? Have you, you know, it must, you know, have you gotten pushback?
Yes. Yes and no. One, I don't advertise it too much. I mean, people know I'm crazy. I low carb, like my colleagues, you know, may make fun of me or tease me. But I do sometimes tell them, like, you know, I mean, I tell them what's happening with my clients and that's a way. And I kind of have sometimes some debates with endocrinologists. It's like, why don't we even talk about low carb with these patients? Why don't we just give more insulin? And you know, they blow you off. Like they're not going to change or, you know, there's no evidence for that, whatever they want to I just don't get into it. I'm very careful in the hospital not to, I mean, on the record, at least I'm all more kind of traditional, but, you know, I keep it generic because I don't want to get myself or others into trouble for going against, you know, standard advice. So diet, lifestyle changes, but I don't particularly go into details. Dietitians, I get into arguments with dietitians.
Oh, I'm the exact opposite, man. In my note, I literally say low carbohydrate diet is indicated. I'll write the
I started doing that with diabetes now that's not on the guidelines.
Yeah, I put the guidelines. There's also studies to support. I write it out, have like a kind of like a standard thing that I build off of, and it goes in the note. Counseled the patient, sat down for 30 minutes, here with sepsis from diabetes. I can't turn a blind eye, even in the hospital. I'm not going to do it.
Well, you know, Troy,
I do it. I just, the way I record it is more, you know, I get into argument or debates with dietitians on TPN. I mean, I'm a nephrologist, so I understand electrolytes and all that stuff, but when it comes to the energy they put into it, it drives me crazy how much dextrose they want to put in somebody who's already morbidly obese. And I was like, don't give him anything for a few days. Just give him some protein. Or why does it have to be a certain way? Like, these are the guidelines. So a lot of times they make changes and I go and then lower the dextrose a little bit. Well, they're not meeting their calorie needs. I was like, I don't care.
They're curing the soy deficiency.
Yes, yeah.
The soy oil and all that stuff, right? Yeah, no, and Troy, you raise a very important point. Is when 70% of the doctors are employed by big groups, they don't have the freedom to speak. So what's happened is people can't really, even if I get a lot of private messages from doctors saying, I agree 100% with what you're saying, but I can't say it publicly. And that is sad. It's basically like, I know it's helping people, but I have to whisper in their ear and tell them, okay, don't let anyone hear. And it's like, well, it's crazy because you're trying to help your own patient and it's maddening.
I have a hard time with my family. I mean, I did. Like, eventually I cracked them, but they were resistant. My dad has been on medications for 29 years with high blood pressure, 6 of them, up to 6, healthy otherwise. His cardiologist keeps adding things. Eventually, statin was added and all that stuff. When they visited at Christmas time and they visited in Houston, and the pandemic was crazy in Lebanon, so I left them with me for 5 weeks, and basically fed them myself. I cooked. I basically changed the lifestyle. I had no option. And they lost weight. And while he's here with me, I took him off 3 or 4 medications. And my mom, who had started becoming diabetic and was on 1 pill and a blood pressure, took her off all medications within 4 or 5 weeks. That's when they saw it. I couldn't influence them otherwise. I kept telling them and telling them. They would say yes, but they wouldn't do it, all the temptations. So now, those 5 weeks, they're basically helping others by advising them back over in Lebanon, and they're helping others. So this is awesome.
Yeah, that's
awesome. I
awesome.
have 1 or 2 pills on my dad. I just want to take him off.
I saw that tweet. I saw when you tweet that. I was like, that is awesome, man, to be able to, hold them hostage and get them in shape.
People don't have the luxury.
Yeah.
Sometimes you have those 3-4 weeks to transition is so hard. We forget. I mean, I struggled. I remember I fell off the wagon multiple times before I really stuck to it. So those 3-4 weeks are super hard on people who have the intention to change but unable to.
And you get difficult relatives that won't leave. You just say, we're going all keto from now on. And then okay, I'm going home. I'm not going to
Yeah.
They don't want to come back. But then when they're feeling better, they can't argue anymore, so it's great.
Exactly.
So Turo, man, we did it, man. We survived an hour. He survived 2 hours with me, so he's durable. That proves he's durable. We had 2 hours of chit chat, man. This is awesome. What a great morning.
I'm hoping one day, Dr. J is going to say, "Wow, these guys are actually reasonable people. Let's work with them. Let's figure something out.
Let's do it. Let's talk."
I'm hoping he's going to, come by one day and say that. So
you're licensed everywhere.
Yeah, he's licensed everywhere, man. That's why I'm like, I don't want to step on Dr. J's toes, man. I'm going to let him do some business down in Texas. So
he's in Houston. You know what? You're going to need
still at the proof of concept level.
Yeah, but you'll prove the concept because it works.
Yeah, we already proved the concept. So now I need your expertise to figure out how to.
Yeah, and I hate to correct guests, but I'm going to correct you on one thing. It wasn't Tro and I leading the way. We were following a lot of good people that had the courage to stand up well before us. We just saw and say, hey, this makes sense. Let's try it, right? Jason Fung opened the door, Professor Noakes, all these people who really came way before us. And then there's people with the courage like Ted Naiman comes and say, hey, I'm going to do it a little different, guys. And then someone else comes and says, hey, this works for me. So we've heard the gambit, and that's why our job is to sit back and say, what's working? We want to go towards what's working. It's not about arrogance. It's about saying, okay, if higher protein is working for you, great. If it's not working, let's go higher fat. Let's try different things. But again, how counterintuitive this is, and I see it all the time, and I know you two see it too. They say, well, you have fatty liver disease, so we're going to put you on a low-fat diet. So what are they doing? Giving a bunch of carbohydrates that's making the fatty liver disease worse, and it gets worse and worse. Then we put on keto for a week, and they're really upset when it works. They're happy and upset, right? Because they're like, this is all I had to do is this? Right? This is crazy. I'm eating a steak and I'm like, my liver's better. It's so crazy. And they obviously alcohol, all these other things that factor in but I'm telling you, high fructose corn syrup, it's a disaster. It's a disaster for the liver. So that's why, having docs like you in the hospital that can help people, help get them back on track and help them, give them some hope, when they're really sick. That's really critical. So we're going to go to some questions, Tro, if we have any. And also, just so people know, how do they track you down if they want you to help them out to get back on track in Texas for sure?
Of course.
How do people find you?
Oh, okay. I thought we were talking about questions. So I'm on Twitter, Elie Jarrouge MD. I'm also on Instagram, Elie_Jarrouge. I post more food pictures and elaborate on some of my tweets. And I also have a website if you want to reach out, metabolichealthmd.com. And easy to reach. And if you ever want a coach or a doctor in Texas, I'm happy to help you come off medications or make you healthier overall.
Shoot, man, I should have got that domain name. I love it.
I was surprised nobody had taken it.
I have a 20 of them, man. I could sell you, but I don't have that one. That's good. So that's awesome. Let me start out the questioning since what's your feeling or what's your idea with people who say, oh, high protein is bad for the kidneys, being a nephrologist, because I know Jason's addressed this a ton of times.
Yeah, it's been addressed so many times. There is absolutely no evidence that high protein damages the kidney, with one caveat. If you already have advanced kidney disease, then you have to limit your protein because protein gets processed in the kidney. But what causes you advanced kidney disease? Usually more than 50% of the time is diabetes. So definitely protein is not a problem unless you're near dialysis. Other than that, this is the only way to get healthier, is to increase your protein.
Awesome.
Yeah, we have a question here. Basically, we got a couple of questions. My GP is really into current literature, but it's still part of the classic treatment. What would be the most convincing source to point him to grab his attention to the benefit of low carb keto? Can I help you out? Can I
Yes.
Can I help you out here, Julie? Okay, Julie, we're going to help you out here. All right. There's a couple of sites you can go to. Okay. The Society of Metabolic Health Practitioners has a listing of different studies. On my website, I have a listing of different studies, drtro.com/studies. Okay. That literally categorizes studies kind of based on the topics you want to hit. So, or just have them listen to LowCarbMD. I mean, it's as simple as that. How you can give them the podcast.
And I would say
great books out there.
Yeah, yeah. And I would say too, like Keto Mojo has a great website with a lot of stuff, and also Joy Kitty, who we've had on the podcast a couple of times, she has a really great website with a lot of great information. Low Carb RD, LCHF RD.
Yeah, it's excellent. A lot of different data. Now,
from attention deficit disorder and all that kind of stuff is very well done.
Yeah, the second question here is about getting inexpensive CGM. Listen, I'm going to let you guys know a little secret. The CGM prices are about to go up. They used to be $70 a month. They're going up to $140 a month. So we are probably going to be able to offer them at cost soon. So we're coming pretty close, including shipping. So just call our office if you're looking to, if you need it, for medical reasons. But you'll have to, just give our office a call. Okay, that's it. That's all we got, Brian.
That's all the questions we got.
That's all the questions we got.
Awesome.
We answered them ahead of time.
So we just answer our own questions.
Vic said, awesome Instagram account. And Brooke says she missed it, but she loved, great work and thank you. And Julie says she's on NutriSense, but it's too expensive for her. So that's what we got here so far.
You can do it all without spending a penny. Just measure your waist. I tell people don't make cost a barrier.
Yeah. Honestly, most of this could be done. I mean, Atkins didn't have a CGM. It's a great tool. It's an awesome tool. To be able to see it,
And look at what Dr. Unwin's accomplished. They don't even get insulin level. I mean, it's ridiculous how limited he is and what he can do, and what a great clinician he is, that he's taken over 100 people off of meds already, and that's incredible.
So you don't need the CGM. It's just we are an app and technology-driven world. We have an app for our bank accounts. We didn't have that 30 years ago. Now it's considered normal, right? It's considered standard. At some point, they thought the blood glucose meter was crazy new technology and nobody needed it. Just the finger stick, right? This was in the 1980s. If you listen to Bernstein talk about it, he was considered a heretic because he thought people should check their finger sticks after a meal. And that was too expensive and too cavalier, right? At the time. So the reality is, do you need these things? No. Are they helpful? To a lot of people, yes. A lot of people, yes. Guys, this was awesome.
Thank you, guys. This was really awesome.
This was awesome, Brian. I always love it. Dr. Jarrouge, this has been an absolute pleasure.
Thanks so much, man. It's been so fun having you. And it was great spending the whole morning with you. I really enjoyed that. So, because your story is really powerful, what you've been through in life, and, talking about other stuff outside of medicine. I think a lot of times people forget that their doctor has a life too, that they have family and people that love them. And, when they're working 14, 18-hour days, what I would say is, like, look, be kind to the docs. They went through a lot to get to where they're at. We may not agree on all topics, but we do agree. We really do want to help people. Sometimes we're misguided and there's a system they got to deal with. It just, it's just a tough system. It really is, you know, being in and out and seeing all that stuff. So, hey, be compassionate to your doctors, be kind to each other, you know, educate yourself. Don't just go with the party line. I think you have to really look at the science and the data, because I think for me, the last year and a half has been very, very enlightening as to vested interest. And you know, there's a lot of people on Twitter who are paid to do tweets. I know none of us have been paid, and I'll publicly say that again. And I'll never will take a dime for anything I do like that. So I think it's really important that we disclose when we have conflict of interest, and I think we should hold doctors and our thought leaders accountable to that.
Agree so much, guys. This has been great. Thank you.
Thank you,
Jarrouge.
Brian.
Brian, thank you.
Thank you, guys.
All right,
awesome
guys.
stuff.
Thank you for Patreon supporters for keeping
us
informed.
Thanks for joining us, and we appreciate all the positive feedback and all the support. It's been great. Hey everyone, I wanted to let you know about an upcoming conference that really had a huge impact on me, that's helped me on my journey and helped me to really understand metabolic health and what we're doing to make people healthier. And so I have my friend Doug Reynolds, who's the boss, who's putting on this conference. So Doug, tell us about the conference that's coming up, Low Carb USA San Diego. I love it because it's right next to my house and I get to sleep in my own bed and come, but maybe I get to stay in a hotel this time. I don't know. And I get to speak. So man, it's awesome that we get to all meet up together and build community. We all know how important that is. So Doug, welcome. Tell people about what you're doing.
Yeah, I mean, thanks, Brian. You know, it's really exciting to be able to do it in person again. I think there's so many people out there that are just clamoring to be able to talk to people again and give someone a hug and just collaborate like you know, has become so predominant in all the other events that we've done before this COVID thing hit. One of the things that's come up since when COVID hit, we couldn't do it. So then we flipped over and did virtual versions of the San Diego event and the Boca one. And we had a lot of people actually sign up and become a part of that. And so what it has done for us now is make us understand that the live stream component can be very effective for people that can't make it to the event. So this is a proper live event. And I think I want to make this very clear to people that they think it's like, so many people have asked how many of the talks are going to be virtual and how many are going to be in person. And the answer is every single one is going to be in person. So we will have a live stream component. People will be able to access it via live stream, but all the speakers will be there in person. Anybody that hasn't been able to make it obviously just hasn't made it into the lineup. And I think that's really important, and it's really exciting that we've got all of these people coming out. And some really good names, you know. Gary Taubes has been a stalwart with us. He's like always supported us. The first guy to say, you know, let's do this. You obviously, Rob Sivers, Tro, Tony Hampton, Brett Scher, Dr. Ben, Amy Berger, Diana Rogers. I'm really excited that she's, you know, on the sustainability side. I'm really excited that she's able to make it this time. We've been trying to get her to an event of ours for a while. And this is the first time. Andrea Salcedo is a really, really amazing. She did one of the Grand Rounds talks for our SMHP. And she's a gynecologist. We've had a lot of comments from people from the feedback forms and stuff saying that you should get a gynecologist in. So now we have. You know, Michelle Hearn was a potentially Olympic athlete who just like crashed and burned on carbs, and she's a dietitian, and she found keto and eventually basically carnivore, and it's cured her to the extent where she's training for the Olympics again. But she wrote this book called Dietitian's Dilemma, because, you know, everything that she'd learned as a dietitian she wasn't doing anymore in order to make herself healthy again. And so it's really cool to have, you know, a real dietitian's perspective of the problems that they have. She's basically left that vocation because she just couldn't function in the hospital environment, and that where she was. She was not allowed to speak to people about low carb. And so that's a fascinating story. Dr. Gurpreet Pada, I think you might have even had him on.
Yeah, he's doing amazing stuff with pain
yeah,
management.
He's just one of the most incredible people.
Yeah, it's amazing.
Marco Casella I don't think
he's a legend.
At least in this one.
Yeah, he's a legend. I worked with him in deprescribing the textbook chapter, and he's phenomenal. And he's struggled with metabolic disease, even though he's a long distance runner. And he was able to get soda out of the hospitals that he's affiliated with, and that's a huge task.
Yeah,
that's a huge money maker. So yeah, so many great people, and I think the big thing is just being able to sit down. I know. For me, being at Low Carb USA, the first time I was able to sit down and have a cup of coffee with some great leaders that were just there, and they just are there to talk. And so there's so much great information. Anyone else we need to talk about, Doug?
Steve Finney is the latest addition to the lineup. I've been chatting with him for a while now, managed to get him on board. Dave Feldman as well. He wasn't sure if he was going to be able to talk because of this research that he's got going on, that he might not have been able to actually speak in public. Arthur Agatston, I think, is going to be fascinating. I did a podcast interview with him the other day. I didn't even know until very recently, but he's the guy that discovered or defined the calcium score. It's actually known as
his name.
Yeah.
And the South Beach diet. He's done so much work. I mean, he's always trying to make people healthy. He's doing a lot. Yeah. So yeah, it's just great the amount of talent you pulled in. And
we've got amazing. The whole, for those people that know about the SMHP, which is kind of the other hat that I put on, the other organization that I run, that nonprofit, pretty much the entire board of directors for that is going to be at this event, either speaking or at least present. And then, the other committees, we've got the panel of advisors for the clinical guidelines. You're on that panel. It's just, there are so many, it's just going to be so many fascinating conversations that are going to go on over that weekend. I can't wait.
Yeah. And it's just, and you're also bringing a lot of vendors, like Keto Mojo is always there, and a lot of good people. Yeah. And so try different products, and there's some great Restore program who's doing some great work through your program and really getting it out to the masses. There's so many great people coming out. So I would highly recommend it. And I worked out a deal with Doug because I want people that, sometimes finance is a issue for people. So I said, Doug, look, my people need a discount. Our people need a discount. So what do you work out for us, Doug?
So yeah, we've got it. If you use the code LowCarbMD, it gives you 20% off and it's not just the ticket. For those people that sign up for the dinners, for those people that require a CME certificate, whatever they add, whatever their purchase is, the total amount, that 20% comes off that total. In the past, when we gave discounts, it came just off the ticket price. But it's not that great a guy. It's actually just that it's easier for me to manage. To take it off the total, but yeah, as a result, everyone else scores, right? So
that helps too. And then is that for people who come in person and online also?
Correct. Yeah. Right. So whatever is in your cart, basically, that discount comes off the total. And the other thing is, one of the options in the upgrade options. So if you only buy the ticket now, you can upgrade and buy the VIP dinners later if you want to join us. Or you can, if you signed up for the live stream and you wanted to upgrade to in person, because now you realize, hey, everybody's traveling and actually I think I can do this. Then you can still use that code on your upgrade options as well. So you can still get 20% off if you decide later. So if you buy the live stream and later, in beginning of August, you decide you want to actually come in person, you can utilize that code again then for the upgrades, and they will apply, which doesn't happen for anybody else. So.
And what are the dates?
26th to 29th of August.
Awesome. And it'll be live. And if you want to stay in your hotel, I think, can you live stream it from your computer wherever you're at?
Yeah, so that's the thing, is it didn't used to be like that either, but I think every time we do this, we improve it. So now somebody that's in person has access to the live stream as well. So if they if they want to watch part of it, you know, in their room or something, they can. We would really prefer that they come down and you know, sit in the audience. But if for some reason that's not possible, they can watch it, or they miss something, they can go and watch. They can go back and watch that evening or something. They can, you know, watch a talk that they missed or something like that. And then they get access. They get access to those recordings after the event, and then within about 2 weeks, we normally are able to get all the individual videos of the talks populated on that site as well, and they have access to that forever. So
yeah, it's great education. I think being able to, because even being there, I've had times where I want to interview someone or just spend time with someone because they're coming from South Africa or something, and I miss a talk, and I was like, oh shoot, I want to see that one. And so it really does free you up to say, okay, I'll hybrid. You can sit and go down. You can talk to people. You can, you know, watch it later that night or on the weekend, because a lot of us are really busy. So that is outstanding. I'm really glad. That's a huge improvement for sure. And you know, in some of those talks, you're going to want to watch it a couple of times to make sure you absorb it all, so you don't have to feel like you have to take notes. And Doug hates people taking pictures in the meetings, and because it's distracting, you know, for people behind them. So you'll have access to the talk, the PowerPoints and all that kind of stuff. So I think that's really huge. So hey, everyone, thank you. I think this is a huge thing. The reason I had Doug on, we have no financial interests. You know, it's really just because I know the benefit of this and how it can help people trying to live a better life and getting on track. And I know it helped me immensely and changed the course of my life, really. So Doug, thanks for all you're doing and continue to do. And you're making a massive impact. So Low Carb USA San Diego, I would highly recommend everyone come out.
Appreciate that, Brian. And thank you for what you're doing. I mean, it all started at one of our meetings many years ago. But I'm so glad that you made it to that meeting, because you're doing great things now too. Thank you.
Hey, I get some good South African food out of it sometimes. So it's all good. So, hey, everyone. Hey, thank you for listening and thank you for your continued support.